So welcome back to a brand new episode of Walkin and Talkin with Tim. So my guest today is Brian Sweeney, and Brian is the president and COO of Jefferson Hospital, New Jersey. So interestingly enough, that's actually a very specific title, and I'm going to make that my first question for Brian to kind of explain what that means.
Well, thank you for having me. Jefferson has grown a lot through mergers and acquisitions over the last 4 or 5 years. And in my role, I'm responsible for any of the services that we provide in the state of New Jersey. I have 3 counterparts in Pennsylvania. They each manage a region. And any of our hospitals, our physician offices, our surgery centers, our home care, that all reports up to me in the leadership role that I have here at Jefferson Health, New Jersey.
Roger that. So you said when we were walking around that one of the things that's super important to you in your role is community impact, which is what this whole thing is all about.
Yes.
So what are some of the things that you get to do in your role to give back?
So a couple things. One is obviously
A little slower, my friend.
our mission of providing healthcare services is just so important. So I think the fun thing about being in a leadership role is I get to lead all of our teams in terms of the community service that we provide.
Right.
There's a lot of great programs and services beyond the traditional hospital that many people are familiar with. For example, we have this program called Project Search, which is really where we partner with disabled individuals in the community from a development perspective and help them have a career, and they come in and they do mentoring and coaching with us. And one of the side benefits has been we've been able to employ them, and by doing so, they're
great.
contributing back to the community. But it also helps us too with keeping our workforce local in New Jersey.
Wow, that's pretty cool. So we talked a little bit about stuff that you like to do on your own, by yourself, right?
Yeah.
So you said you guys have a lake house you like to go to, but you also said that you have a farm.
Yes.
And that's, to me, really cool. A friend of mine has a farm, and that excites me because I love the idea of that tranquil, just like being out on the farm, animals. It's got to be calming and relaxing, right? So tell me about that. How's
Absolutely.
that for you?
So I got into farm life actually through my wife. I had nothing to do with farms before her, but I learned very quickly when we were dating. She was riding horses all the time, and if I was going to have a relationship with her, I had to learn about farming. So she taught me to ride, and we're fortunate that...
Are you good at it?
I'm pretty good. Yeah, I've had a few injuries over the years, but...
Any jumping or just...
Jumping, cross
Really?
country.
You did all that, huh?
Yeah, she taught me. So it's nice to have your own instructor. But we've been able to live on farms over the years. We've had a few different farms, and it is very tranquil, to your point. The jobs that I have in healthcare, it's obviously very busy, and there's nothing more rewarding than getting home and being on the farm. And we have sheep right now, and we have horses, and it's just a very different lifestyle. It's become part of who we are, and it's fun to have our nieces and nephews over there. They like all the animals. And
you grow anything?
we don't grow anything. Yeah.
So no food, just sheep, horses, anything else?
We have some dogs, we have some cats. We've rescued a lot of animals over the years. So
Oh, yeah?
we're the place that when you find an animal, you drop it off. So
Is
we're
that
always
right?
open. Yeah.
Well, there you go. If you find an animal, drop it off at Brian's farm. There you go.
Happy to have it.
We'll get you information later on that. So you learn how to ride a horse. That's actually really cool.
Yeah, it's fun because where we are, there's a lot of trails that are still open. So you can navigate all the way around in the local community, and you can go really far, which is great. Good exercise too.
So again, let's go back to the community impact thing. So outside of the hospital, I'm assuming we did talk, and you said there was other things you were involved in as well, right?
Yeah.
Outside of that frame?
Yeah, there's in my role, you're involved with a lot of local boards, like the Chamber of Commerce, for example. So that's how I got to meet you and many other people. But that has been excellent to be able to connect with business leaders and to talk about common community challenges and opportunities. I've really enjoyed the networking there. And then Camden Coalition.
Oh, yeah.
My colleagues and I, we're heavily involved with the Camden Coalition. Phenomenal organization, of course, in Camden County. Mm-hmm. Lots of great work, especially around food insecurity and homelessness and behavioral health and so forth. So it's been great to be able to connect with my other colleagues in New Jersey on shared community challenges. It's really going to take all of us working together as healthcare providers with social services, with government, to make an impact, especially mental health these days, which is a real challenge through COVID.
And speaking of that, obviously things are coming back as far as upticks and things like that with flu season.
Yes.
How's the hospital doing with the ER and all that? Are you busy?
We are. This is typically our busy season anyway. When you go into the fall, we see flu, we see cold. A lot of the respiratory illnesses are here. And then from a procedural perspective, typically a lot of elective procedures happen at the end of the calendar year, especially with people having time off and so forth. And then of course COVID, which is unique. So it's a combination of all those factors.
Yeah.
And then also some of the preventive care that people really did push off early in COVID.
That's busy now, right?
Yeah, colonoscopies, mammographies, for example, all those screenings that are really critical from a prevention perspective. A lot of people were
You're encouraging them to come back.
But now we've been out there promoting it through health fairs and community outreach, and those people are all coming back, which is great because we want to make sure that those preventive services are maintained, and if there is something that comes up unusual on a lab test or a radiology study, that we get on it early from a treatment perspective.
That's good stuff. So I guess quick question I didn't get to ask you while we were walking around. Are you a music guy? You like going to concerts and stuff like that?
I don't. I'm not a big
You're
concert
not
guy.
a music guy?
No.
What's your thing then? What do you like to do besides the farm? It's got to be something.
Well, we like to be outside a lot. You know, we live on the farm, so we're constantly doing outdoors activities,
Sure,
like
hiking.
fishing and hiking and riding the horses, of course. So outdoor life for us is,
Any rock climbing in there?
I've done rappelling,
Have you?
yeah. And that's been adventurous with an expert.
Any jumping out of the plane?
Would
That
never
kind of
do
thing?
that.
Yeah. Have you ever wanted to do it?
No desire. None
No, really?
whatsoever. No. Too dangerous.
Yeah. I have a desire to do that. So if you ever, think you might want to do that, let me know.
Okay, I'll remember that.
Good stuff. So, when we're talking about just the farm life in general, what have you seen on the farm that has impacted you the most? Like, have you seen, a horse being born, a calf being born, that kind of thing?
Yeah, so a bunch of different things. I mean, one of the things that's a little bit different is ironic because I'm in healthcare, but you're somewhat on your own with caring for the animals. The vets come to your house when there's an emergency, so you're there in the middle of the night when something happens, like a horse will colic, for example, and you're helping the vet in terms of all the studies and all the treatment. So that is very, very different. And then being able to just be there all the time to support the animals, because one of the challenges with being on a farm, there's no sick days. The animals are counting on you for feed and to be let in and out and from a care perspective. So that's another thing that is somewhat a limiting factor when you're trying to travel and you need to have somebody cover you so that you're able to get a break with vacation or something else if you want to travel.
Right. Any advice for the young people coming up that want to do what you did, because you were a nurse first,
Yes.
and you got your MBA, and then you have a long list of positions that you had to get where you are today?
Well, healthcare is just a fabulous career, and even through the pandemic, I'm really happy to see that the enrollment in nursing school, medical school, is really high. I think a lot of people were fearful that would scare everybody away, but it's done the direct opposite, because healthcare is a way for you to give back. And one of the great things about healthcare, it's really broad, and you're able to build a really great career. And as an academic organization, one of the great benefits is tuition reimbursement programs. So you can come in ground level, be an EMT, be a tech, be an environmental services worker, a transporter, and really build a career. Go back and get your nursing degree. Today, you can become a nurse practitioner, you can become a physician's assistant. So there's just a lot of options for you for those that are considering healthcare as a career. And so I always encourage people to go out there to do the research, to get to know mentors, and a lot of people are excited to share their story about healthcare, and I've had a good run. I started as an EMT volunteering in the community and went back and became a nurse at night, and then pivoted and went into business and strategy. So I'm 25 years in at Jefferson at this point. It's been a really rewarding experience and career.
That's a long time. Congratulations. Well, listen, thanks for being on. And if anybody wants to get a hold of Brian, I imagine they could probably just look you up on LinkedIn or something.
LinkedIn or the Jefferson website. My bio is there. So thank you very much for having me. Very exciting.
Listen, thanks for watching. Keep on moving, and we will see you next time on Walkin' and Talkin' with Tim.